Good to see you, Jason. Thanks for joining us.
Good to see you, Mike.
So I want to talk a little bit about identity management within cyber-physical system environments. And is this a place where traditional IAM, as we understand it, does it still work? Does it fit within CPS? And why or why not?
So CPS, traditional IAM, I don't think it was ever designed for identity and access management. But when we think about things today, especially with the rise of AI, we have this concept of entity as the identity. So it's, when I talk about identity and access management, it's for the entity. And that could be a person, all of us biologics, but in the cyber-physical space, that is, sometimes it's applications, it's a physical system, it's a biomed device. It's not limited to just, a person.
Right.
So the claimant for an identity doesn't have to be a person. And a lot of times when we're talking about the identity and access of it, that claimant being, let's say it's a biomed device, the claimant, we've got to be really sure that that claimant is that identity. And that identity, which is really just a bucket of privilege, matches what it actually is. So there's a couple of levels there, and being able to provide that high confidence assertion for the authentication, like I am this identity, this claimant is this identity, and then making sure that you have a rational authorization. So is the identity itself permissioned just right? Mm-hmm. And that is a Goldilocks statement, because it can't have too little, because then it can't do its work. But it can't be over permissioned, because that's easy, because that's where we start dipping our toes into massive risk.
And in your industry, you have, I'll call them cultural issues. I mean, you want to make it as simple as possible for especially clinical staff to authenticate, and just their job is not security, it's patient care.
Yes, I've probably heard that once or twice.
Yeah.
In the last 15 years of doing this particular work in healthcare. It's about making it as frictionless as possible. Okay, it's not that our providers and caregivers don't want to do it, because they actually do understand that this is part of that care continuum. So we have to protect our patients' physical health, definitely. But when you think about their mental health, or their financial health, or their identity and privacy that goes along with it, the integrity of systems, the ability for the organization to operate, those are all needs to have proper levels of authentication and authorization. The trick there is to make it as frictionless as possible. How do we understand it and then provide the right level of authorization at the right time to the right people?
And with regard to CPS, for example,
mm-hmm.
What are some of the specific risks related to identity that you're trying to curtail? Are they much different than kind of the traditional risk we understand with IT, IAM, for example?
Well, let's talk about amplification.
Sure.
So, because I think that's what it is. So normally, if it's Jason having to log on, I've got one identity to one credential. Oftentimes, I'm like, do I need to have every single infusion pump? Sometimes folks will yes, each infusion pump should have its own identity as a claimant for that going. But oftentimes what we see is like, hey, we're going to deploy the fusion pumps. We have a service account. So that account represents this set, this amplified set. So not a single entity anymore, it's multiple entities with the same identity, which is very confusing, because you have if there's a problem, like, where did it happen? Where is that one-to-one relationship there? And that, you're like, hey, I've got tens of thousands of OT or IoT items out there. You mean I need to have an identity for every one of them? Each one of them, I need every single one of them, I need to treat each one of them as if they're their own little baby employee. And if you're looking at, I would say the conservative view on that is yes, each one needs unique identity, each one needs its own unique piece. But we're talking scale now. How do you do that in an area where you have limited budget, limited resource, maybe limited licensing as to what I can use to authenticate things? So, I think traditionally, it's like, of course, Mike and Jason, those are two separate people. But infusion pump 1, infusion pump 2, they're infusion pumps. Or they're, they're just things. And I think we need to be moving away from that idea that these entities can be glommed together. Now, that can be a little controversial because like, oh my gosh, how am I going to manage all these things? But we would manage those things through process standardization, and the new entity on the scene here, AI, can really help.
So I know tell me a little bit about the journey that you're on. I know it's kind of maybe early days for you guys, but and just how you're bringing AI into this, what you hope it'll simplify or how it'll improve the entire project.
So, not-for-profit healthcare, we're not awash of resources and funds out there. So how do we amplify, augment, and force multiply the resources we do have? And that's AI. That's where it really excels. But I think not in a way that a lot of people are like, I'm going to use AI, I'm going to do these fantastic magical leaf tinsel skills. Where it's really going to provide benefit, and is starting to provide benefit, is, hey, how can I use AI to help with my periodic access review, as an example? It's a manual process, takes a little bit of time. You have to understand, like, what is this role, and then push it out to the people. Should these people still have this access given their new role or their current state? And a lot of times that gets pushed out to managers that maybe don't necessarily know, or a director or a VP that's abstracted from the actual work being done or the actual component there. So it's difficult, and so then they have to go through an extra round of research in order to make that determination. Well, you can take away a lot of that mundane work in there and say, hey, look, here's this person, this is what it means, and have AI do it for you. Set that up. Say, okay, here's this person, here's what they've used. This is a big thing. Here's what they've used, and here's what they're privileged to do. So that's a deeper level of analysis that we might not have been able to do in the past, or at least at scale. We can do it at scale now with AI. I can get in there, look at it, and say, okay, here's this role, and here's what they've accessed over the last period of time that we're doing this review from. Now I can give it to the manager and say, do you really think they need local admin access if they've never actually done anything in the last 12 months that required it? Or is it just sort of this fear, uncertainty, and doubt? If like, if I don't have that access, then I can't do it. Well, we can remove that and give you the right-sized privilege and the right-sized access, and still have this available for just in time if you need it. But no, we remove that and have absolutely no impact to your job. This is where AI can come in and can do that analysis. When you're talking about 10, 20, 30, 50,000 employees, eventually you start talking about real work.
It's massive, yeah.
Yeah, but this can go and do that work that provides that fidelity to the management, the systems, and it can actually rationalize it down so that individual isn't carrying around with them in their identity bucket privileges they shouldn't have, privileges that could be exploited. That's just one example, and so it helps take away that. The other thing we're looking at with it is, you know what takes up the majority of the time for the IAM team? Trouble tickets.
Yeah.
I don't have the rights. I wasn't able to do it, or I got locked out, or here's trouble tickets. And so if the team is consumed with trouble tickets, where is the bandwidth? Where is the space for them to do the more interesting work? I would say the generative work, because managing a ticket queue is operational, but it is degenerative in as far as, am I moving the program forward? No, I'm dealing with symptoms. I'm not dealing with the root cause. Well, I don't want to always be treating symptoms. I want to start treating the disease. I want to get rid of that. I want to cure some things on it. How do we do that? I'll have AI come in, look at my tickets, look at the queue, and say, hey, looks like a, sounds like a, swims like a, must be a. So as opposed to always trying to whack-a-mole here, why don't we take a look here and now go try this root cause? Take a moment, take a pause, and let's go deal with that root cause. So it can do that analysis while looking and helping the tickets, because us humans, we love to think highly of ourselves, but we work at human speed. We don't work at wire speed. So I might ask AI a question, hey, what's this? Here's the answer, Jason. And then I'm like, okay, I got to process it and I can do my work. AI is sitting there going, just waiting for a question. Let me know what to do. And in that space, we can use things like agentic AI to come in and actually start doing those analysis. So the next time I ask it a question, hey, I need to fix this thing again, it can come back and say, hey, here, we'll help you fix it. And if you did this, you never have to deal with that again. That is the magic here. because when we free up that space, free up that time, so that the team can then say, okay, well, now I have some space. I'm not always working the ticket queue. It's now manageable. That extra space then becomes the generative space we can work with. What else can I do that really help? What's the next thing I can augment with, or assist with, or force amplify with? What are things we're not thinking about?
So as a security leader, does it make you nervous to turn all that over to that level of automation? It's kind of out of your hands.
You have to do it in a rational fashion. Okay, so you notice everything I said there, it wasn't take action. There's still a human in the loop. And I think right now that is going to be key, because AI can't be held accountable. Can't.
Right.
A computer can't. So I can't have it, anything that might have an impact to a patient care, healthcare specifically here. Anything that have a human impact, I need a human in the loop, because I can't hold a computer accountable. I can't hold a program accountable for that. And so the accountability component there has to be inserted. Now, can it do a bunch of things? Yeah, I could use AI for good or for evil, you know, but that's just like any tool, right? I could build a house with a hammer, or put somebody in an emergency room with a hammer. It's not the hammer's fault. Right. It's how we use it, and what are the constraints around that. But from a security standpoint, you start with those guardrails. Mm-hmm. You know, be very clear about the data needed to do it. Don't over-permission it. And honestly, you can even ask the AI, hey, do you have too many permissions? Have you ever used any permissions? No, cut those permissions out. So we have to start thinking outside the box a little bit about it, because sometimes we may not see something that it could, because it's looking at everything all the time in that extra space. Sure. That net time, the no extra time. And so I think it's really about the right constraints, having a human in the loop, and then I think it is inevitable. So we need to guide where it goes right now, or it's going to just go on its own.
So for the sake of a peer, either in healthcare or another industry that might be interested in kind of tackling this type of journey, any lessons you've learned so far that you could share in terms of either a best practice or a pitfall to avoid?
I think I mentioned the over-provisioning. Don't give the AI or the automation too much access. Again, it's that entity, claim it, bucket. Make sure that that's rational. So the other parts are a little bit more cultural, because when you give a new tool to somebody, a lot of folks can say, hey, thanks for burdening me. Thanks for adding more work or something else I need to do. Or, hey, it's a witch, burn it, because it's going to come take my job. You know, so what you have to do is really engage the folks who are going to be using it day to day. How can this help you? Not how do I think it might help you. I might have an idea, right? But how will it actually help you? Is this real? Is it going to add to your work, or can we use it to help reduce that burden so you have that space? And so it's the one. It's not necessarily the technical problem. We can solve all sorts of technical problems. Yeah. It's the cultural and people problem. And I wouldn't even call it a problem. It is literally an opportunity to say, hey, look, you can use this to make what you do more powerful, more impactful. And I always believe in, kind of giving more power to it, giving more power to that person. And that, I don't just constrain them to just use it this way. You do the work on a day-to-day basis. How else could you use it? That by the very nature of using it would make everything else easier or unnecessary. And it's literally that question. Mm-hmm. You ask them that, how could you use this to make everything easier or unnecessary in your work? And they're literally the expert. And they're going to come up with things that are amazing and that I never would have thought of. And that's the power of it. Yeah. So I say, enable your folks on it. Don't, guardrails of course, but enable them as much as you can. Yeah.
Sounds like some champions may emerge internally to help you kind of sell this, so to speak.
Yeah, the story writes itself.
Yeah.
Yeah, so people step in and do it. Yeah.
Right. So as a kind of a wrap-up question in terms of selling this, did you have to internally kind of, what was that process like selling it up to decision makers, for example?
What was the process of selling it up to decision makers? That's an interesting question, because I always, I make this joke. If you know one hospital, one hospital.
Right.
And I can say the same thing. If you know one leader, you know one leader. So strategically, what you have to do is you have to sell the organizational benefit. Is it something that's going to be financially accretive, or is it going to be something that helps us reputationally, or is it going to actually reduce our risk on this investment? That's the ROI that I'm usually talking about, the risk reduction on investment. So it's part of that. But I think you all say, and here's some added value. Because this type of tooling, this type of direction and innovation in security, in business, in supply chain, you name it, there's going to be brand new things that we've never thought of. Never thought of before.
Yep.
And now we get a chance to crowdsource that creativity, and not just as admiring the problem, we're like, oh, that's a great idea, but now we get a chance to test it and implement it. And as long as you provide the right walled garden for that playground, I think organizationally it becomes very easy. But I guess the same question of our rev cycle team. Hey, what do you guys do on a daily basis? And if there was one thing you could change, or automate or augment that would make everything else easier or unnecessary, what would it be? You kind of repeat. It's almost repeating that same process. That question.
Sense.
You ask them, and they go, "Well, if I could do this," and I'm like, "Well, that requires unicorn horns and orphan ears. We can't do that. Right. But this other thing we can." So we get a chance to, because a lot of folks, they want to take advantage of it. They hear there's some great opportunity there. They just need a champion to tell them it's okay, and we can do it. And here's how you can now be the champion in your space, because you're the expert. And here's, what are you going to ask it to do? How do we get there? So it becomes much easier to sell it, but it is a personal thing. One executive, one executive. So.
Great stuff. Thank you, Jason. Appreciate it.